Good afternoon, everyone, and thank you for joining me today. I'm here with Secretary Lourdes Castro Ramirez from Business Consumer Services and Housing Agency, here to give you an update on the state's effort around testing, our renewed testing task force announcing 2 new co-chairs, and a focus on some exciting news around new testing guidelines and an effort to make sure that we're doing all that we can in the state to make sure that the tool of testing is one that we continue to rely on. I think many of you have been with us throughout the journey over the last many months as we have started in what I think of as a phase 1 of our testing journey, when we built the capacity just to begin testing any of the patients who showed up in our emergency rooms with symptoms early in our response to COVID-19, to be able to treat them, to learn about how COVID was going to manifest in our communities, how that spread was going to continue in our communities, and that we began doing that care within our hospitals and clinical delivery system. Then moving into phase 2, where California, as the governor said, need a renewed focus on increasing our testing capacity. We went from 2,000 tests a day to in the early parts of April and late March, to identifying the testing task force as a key solution about galvanizing our focus and our effort to increase testing, to work on supply chain issues, to organize our testing systems across the state, to identify our instruments and our supplies, and to make sure that we have the testing sites and collection sites throughout our communities, through what was really an amazing effort by 2 co-chairs who can't be thanked enough. Dr. Charity Dean, formerly with the California Department of Public Health, and Paul Markovich from Blue Shield of California. Their efforts to really organize what was meeting early a stretch goal of 60 to 80,000 tests a day, to today, where we can proudly report 14-day average of over 105,000 tests done in the state of California, demonstrating our ability to bring the best of California forward as we address our response to this pandemic. We all know that testing in California is a vital piece of our response, not only to focus on taking care of patients who present with symptoms in our care delivery system, but also to understand the patterns of transmission across the state in vulnerable communities in different parts of our state, so that we can respond effectively and suppress transmission as we go forward. The governor has highlighted efforts to focus on novel testing approaches, whether that's being one of the first states in the country to explore pooling, working with our academic partners to understand how pooled testing might be a strategy in lower prevalence populations and environments to really scale and allow our precious testing resources to go farther. Not just depending on the typical PCR tests, which I think you all have followed along our abilities and our challenges to get supplies at different times, but also to look at different types of testing modalities and to really galvanize our research and testing laboratorian community to begin to explore which new test modalities might be available in California. And today, in announcing our new co-chairs with the testing task force, that new mission to not only continue building up our testing capabilities, working on some important supply chain challenges that have reemerged with the increased demand of testing nationwide, while other states across the nation increase their need for testing. We have certainly seen increased turnaround time issues that we want to address today with our announcement of new guidelines and a focus on making sure testing is prioritized and targeted in those communities that have the highest need for testing because of that disproportionate impact. So with that, I just wanted to take a moment to now announce Dr. Bashara Shukar from Kaiser, Senior Vice President and Chief Health Officer at Kaiser Foundation Health Plan. And then Dr. Gil Chavez, who was our founding chief of the Center for Infectious Disease and a deputy director at the California Department of Public Health. Two really incredible leaders, two clinical leaders who understand testing as it relates to COVID, but public health responses more broadly, and are perfectly suited to help usher in this next phase in our testing journey in California to make sure that those populations who need it the most get it in a timely way, that we allow and continue to support testing in a broad way so all Californians have access, but also to meet the needs on some of these supply chain challenges that periodically and currently rear their head so that we can get through them and make sure we use the tool of testing in the most efficacious and advantageous way. So with that, I want to first turn to Dr. Shukhair to make a few comments. Thank you.
Great. Thank you so much, Secretary Ghaly. And let me just start by thanking you and thanking the governor for your outstanding leadership, dedication, and commitment through this challenging time for our state, our country, and as we navigate this significant public health crisis. My name is Bishara Shukhair, and I serve as the Chief Health Officer at Kaiser Permanente, to be asked to co-chair this refocused COVID-19 testing task force and to continue to move our state testing strategy forward, building on the outstanding effort that this task force has done over the last few months. And in my day-to-day role, I lead the teams that are responsible for connecting, for supporting, and for complementing public health efforts in our communities as we support our members and communities across our footprint. And while we have learned a ton about COVID-19 and we've made a lot of progress, our recent surge in cases makes it clear that a lot more must be done to protect our communities from this unprecedented pandemic. And this requires us to continue to stay on top of emerging trends, evolving science, all of which is going to require us to constantly refining our approaches. So a cornerstone of our work going forward must be ensuring that testing is available, testing is affordable, testing is equitable, and is reliable for Californians. So I look forward to working with everyone on the task force to get us there. So thank you so much.
Thank you. And now, Dr. Chavez.
Yes, thank you very much. I too want to commend the Newsom administration for what I think is a stellar response to the pandemic. I have had the privilege since 2003 to lead many public health challenges in California of infectious disease nature, starting with SARS, all the way through H1N1, measles, Ebola, Zika, and many others. And in every one of those public health challenges, testing has been at the forefront of our response. It's very clear that for us to be effective, we have to have a robust and well-working testing system. I am very honored to work with Dr. Ghaly and Dr. Shukhair in continuing the great work of the task force and ensuring that we adapt the work that we are doing to the continuing challenges and evolving nature of this pandemic. I am truly excited to be here to provide some service to the people of California and look forward to it. Thank you very much.
Thank you both, and thank you for your agreeing to join as leaders of this task force. I know the members of the task force who have already made incredible contributions will appreciate your leadership and focus. And as we continue to set out new goals for our testing volumes, new approaches to testing, I couldn't be more pleased with the governor's selection of both of you to help lead this work. Today also, we will be releasing updated testing guidance from the California Department of Public Health. They will be posted soon on the website, outlining not just tiers of priority populations for testing, but also tiers for priority testing processing. We have experienced an increase in testing turnaround time as the surges across the nation have created challenges of getting tests processed, not just collected, and ensuring that our guidelines not only say who needs to be tested, but give some guidance to labs on which specimens to process first. We know that patients awaiting care in the hospital who may be COVID-19 positive need that test result so that we can appropriately cohort those patients in the hospital and provide the necessary treatment to their specific diseases. Similarly, as we see outbreaks across our state, whether that's in some of our essential businesses, within some of our own households, within communities, we need those test results more immediate so that we can do the correct things as relates to isolation and quarantine so we can suppress transmission. Furthermore, we have experienced outbreaks in both skilled nursing facilities, in other larger congregate facilities like our jails and prisons, and ensuring that we're able to get results, not just collected quickly, but resulted quickly so that we can meet the moment of addressing those issues on transmission in what are challenging congregate care facilities where we know we not only have difficulty containing the disease, but we have such a high level of undertreated and underlying health conditions which make those populations more vulnerable and susceptible to COVID-19. Furthermore, we are also announcing soon emergency regulation by the Department of Managed Healthcare, which will look to work with our health plan partners to ensure that reimbursement for all testing in California is covered, especially for the most essential workforce members where we know transmission is greater and that the risk for bad disease is high. So I appreciate the partnership with all of the health plans across California, with our trade partners, who help us make sure that we do this in a responsible way and that that patients who need care and need testing can get it within their routine delivery systems. It's going to require our co-chairs and the task force to work with our healthcare delivery partners in small practices, large clinic practices, and big group practices across the state, not only to provide testing, but to make sure that those partners have the appropriate PPE and testing supplies to provide that testing in sufficient quantity to meet the demands of California. That then will help us allow the statewide testing efforts with OptumServe and Verily, our partners in the communities doing community-based testing in both brick and mortar testing sites and also mobile testing sites to reach disproportionately impacted communities to a deeper degree so we can make sure, as our co-chairs identified, that we can meet the equity challenge with testing that we face not just here in California, but across the nation. So with that, I would like to hand it over to Secretary Castro Ramirez to talk about the exciting work she and her team have done to contribute to improve testing in California as well.
Thank you so much, Secretary Ghaly, and thank you also for the opportunity to work with you as we redouble our efforts, shift to a risk-based testing guidance, and also ensure that testing remains a top priority in California. The Business Consumer Services and Housing Agency oversees the Department of Consumer Affairs, which licenses nearly 154,000 doctors, more than 450,000 nurses, about 13,000 physician assistants, and 46,000 pharmacists. That's more than 663,000 healthcare providers all across the state, many of whom have been on the front lines treating patients, caring for families, and slowing the spread of COVID-19 throughout this pandemic. As Secretary Ghaly has mentioned, we must be deliberative and also creative about how we are continuing to meet this moment, especially as it relates to expanding our testing capacity. COVID-19 is not slowing down, as we all know. It affects us all, friends and family and neighbors and coworkers. So as a state, we are collaborating to strengthen and find sustainable ways to stop the spread and protect all communities. Part of that effort will involve moving more testing to healthcare provider offices and laboratories to allow state testing sites to focus on individuals who are harder to reach and at a higher risk of COVID-19. That's where we all can help. Today, our licensing boards will begin reaching out to doctors and pharmacists, physician assistants, and nurse practitioners. We will encourage them to partner with us in this effort to expand testing capacity by performing COVID-19 testing in their offices. We will also share the updated guidance and the new regulations that will require health plans to pay for the cost of tests in most instances. This will allow vulnerable populations to be able to obtain appointments at the state testing facilities. And we will also continue collaborating with professional organizations that represent our licensees. Healthcare professionals have truly done heroic work, meeting this moment, caring and treating patients and fighting COVID-19. And I know that they will continue to play a key role in the success of this updated guidance that will be released later this afternoon. By moving as much testing as possible to these providers or to local labs, we can increase access to testing and be able to identify the patients who meet the highest testing priority. That will help us focus on the highest risk Californians. Healthcare professionals have been meeting the moment, and we look forward to this continued partnership. Thank you, Dr. Ghaly.
Thank you, Secretary Castro Ramirez, for your partnership and your incredible team on moving this forward. It does take all hands on deck to address this pandemic, and testing is no small part of that. So we're grateful for your partnership. I will just add that one of the key points to raise is that testing, as we look to the opportunity and the challenges of reopening schools and bringing on-campus learning back to California, and as those decisions are being made, today's announcement of really working hand in glove to make sure that testing for some of our most essential and vulnerable workforce members is available. This will be no small part of creating the confidence and the solutions to bring students back, to focus on the health, not just of students, but the primary importance of the health of staff and teachers at schools, and that testing will help us ensure that we are setting up California for success in that important mission to bring kids and learning back to our campuses. I will also add that I am excited to report that the testing task force's incredible effort on working with a number of lab vendors, a number of our healthcare delivery partners, and our academic partners, we've been able to secure and ensure that we have nearly 330 medium to high throughput testing instruments across the state. That together the capacity of all of those instruments is well over 200,000 tests per day, and that working on some of the supply issues and ensuring that testing is adequate throughout the community through strategically placed and adequately placed collection sites, that we can certainly continue to meet the moment with testing, increase the availability, and ensure those most impacted, most vulnerable from COVID-19 get the tests that they need in a timely and appropriate way. So with that, I'm going to turn it over to our Q&A time, and I look forward to answering all the questions that we can get through.
Nicole Nixon, Capital Public Radio. Hi, Dr. Ghaly. My question is about academic labs. Some officials at some of these labs, like UC Davis, for example, say that they're not being utilized as much as they could. They're running a few hundred tests a day instead of the 2,000 that they have the capacity to do. Are there plans to redirect some of these test kits toward public or academic labs that have that capacity?
Yeah, thank you for the question. Absolutely. One of our key strategies has always been matchmaking, right? Bringing the collection of specimens in one place to the lab with capacity on the other hand. And we are continuing to do that. I think we realize that some labs, newer labs, other labs that have focused strictly on the patients that they have in their hospitals and clinics have capacity. And we're working hard on a very regular basis to match up the demand for test resulting with the capacity there. UC Davis, many of the UCs across the state, other academic partners, and some of the medium-sized commercial labs do have capacity, and we're working to match them up so that we can get the test turnaround time down throughout California.
Sophia Balog, Sacramento Bee.
Hi, Dr. Ghaly. I'm hoping you can flesh out some of this with some numbers for us. So I know the governor yesterday mentioned that part of this new focus of the reformed task force would be cost savings. And it sounds like from what you're saying that part of that would be achieved by shifting more of the testing testing costs really to the health plans. Is that accurate? And can you give some clarity and some specific numbers on how much the state is spending on testing right now and how much you would like to be spending, how you would like that to decrease or increase depending on what it is moving forward?
Sure. It's a great question. I think the overall cost of testing for COVID-19 is an enormous one, not just on the state, but on our health plan partners and the total population of California. And we are working on the cost of testing on a number of levels. First, working to make sure that we're paying a fair and accurate cost for all tests, whoever is paying the bill. Working to see whether that cost can be reduced over time by implementing certain efficiencies, by ensuring that our own public health labs and academic labs have access to the supplies where they might be able to do it within existing staff and other hours of operations, so that we can bring the testing costs down from what hovers around just over $100 per test to something lower than that. And every dollar saved on that front will be a dollar that we can use in a different part of the response or towards a different healthcare or other expense throughout the state. So there is the first issue of just addressing the actual cost of doing the test. The second part of that is who actually pays those costs, and working with our health plan partners to cause the health plans and our healthcare providers for the patients that they are responsible for and take care of to be able to pay for the cost of that testing, allows the state-sponsored and paid-for testing to focus on populations that don't have as much access or need additional access to testing, so that we can make sure to catch outbreaks early and address the need throughout and across the state. Another important aspect that our testing task force will take on as it relates to the cost of testing is looking at new innovations. So far to date, the PCR testing that all of you are familiar with is done in a specific way with a specific set of steps that each have a cost. And although we'll try to get the best value for California within the PCR testing market, we also are looking at different modalities that might allow us to diversify, not face the same supply chain challenges, and by doing that, introduce hopefully a more efficient and lower cost testing modality across California. Things like pooled testing also do similar to helping reduce the cost. So this is a multimodal, multi-approach way to address the cost of testing, because we know that with more testing might bring more total costs, and every dollar that we can bring that cost down will be good for California.
Alex Michelson, Fox 11.
Thank you for taking my call. A follow-up to the big announcement from yesterday. So many businesses are really concerned today about their future and about potentially having to shut down. So I'm wondering if you can expand upon the science that went into the decision-making process to shut down hair salons, nail salons, gyms. Have you seen outbreaks in some of those industries? What led to those particular industries shutting down, at least temporarily?
Yeah, thank you for the question. And we have continued to lean on the science, lean on the transmission patterns that our local public health partners are reporting to us and allowing us to guide these statewide decisions. I think there's three important things that we continue to reiterate on how these decisions are made. First, we know that generalized mixing outside of your household, movement where you are mixing with others, any of those events and activities creates an opportunity for transmission. So in general, industries where that happens to prolonged degrees, where potential for lack of follow through on some of our guidelines and guidance around how industries open can and have led to outbreaks in some of those settings. Similarly, a real focus on moving industries that have typically or have traditionally happened indoors as much as possible outdoors also follows the science. And yesterday's announcement was first focused on reducing general mixing in our communities wherein we see elevated transmission rates and more infections, really stressing our hospital delivery system, our ICU systems, which has been a hallmark of the response. You'll all remember that the stay-at-home order did among the most important things, gave us time to prepare, to respond to COVID-19 through our delivery system. I'm grateful to all of our hospital partners, the thousands, hundreds of thousands of healthcare providers who are on those front lines taking care of patients. And we want to make sure that we have adequate capacity there, and reducing transmission by reducing mixing is a primary strategy. And then furthermore, the focus on the outdoors is another key piece that is part of what will be largely a regular way we do business moving forward. So these are obviously hard decisions, but important ones so we can make sure our current increase in cases and transmission is well controlled in the weeks to come.
Angela Hart, Kaiser Health News.
Hi, Dr. Ghaly. Hope you can hear me, and thanks for taking the question. Just a two-part question, one for clarification. Dr. Dean talked about the cost of testing the other day and said the cost was overall around $2,000, and the governor has talked about the cost per test being around closer to like $130. So what is the more accurate number to use, the more inclusive number? And then also, I wonder if you're concerned, we're hearing concerns from counties that they are seeing such an explosion of cases that contact tracing is becoming a futile exercise. Is that on the state's radar? Are you guys worried about that?
Sure. So on the first question, obviously some of the challenges is that when you have a testing site, it comes with a lot of fixed costs. So you need to have the site, the prep, the supplies, the personnel to do the collection. And when those sites don't have as many visitors to be tested that you plan for, the cost per test does go up. But the average cost to do a test from start to finish can be around $100. That is often what our centers for Medicaid and Medicare and Medicaid have set reimbursement at. And we think that that is on average the cost. Of course, when you build in collection costs, it can go up from there. We are looking for other strategies to bring that down so that the state expense and the general expense to the public and the health plan partners is as low as we can possibly get it in California. To your question around contact tracing, absolutely, contact tracing with this level of transmission is much, much more difficult. But we know from partners like at Kaiser and many of the other health partners that we have across the state, our local public health partners as well, that contact tracing can be an effective mode at suppressing transmission, supporting communities around isolating and quarantining appropriately, and that as we build up our capacity to do contact tracing effectively, hand in hand with our efforts to reduce transmission, that we can manage the number of cases that we see throughout our communities. But it's absolutely true, at this high level of transmission, contact tracing is harder, and the state is aware of that. We talk to our partners at local public health about this regularly, and a focused, targeted contact tracing approach, even in this period of high transmission, can and should be able to reduce larger outbreaks and focus on areas where we are certain we're seeing spread across the state in some of those essential businesses and some of the higher risk communities that we've been talking about on a regular basis during these press briefings.
Kathleen Renane, AP.
Hi, Dr. Ghaly. So, for a while now, probably a couple months, the message in many counties, if not statewide, on testing has been anyone can get a test. You don't have to have symptoms. We moved away from that initial, the initial messaging that you had to have symptoms to get a test. So we've been saying anyone can get tested. Is that still the message, that anyone can and should be getting tested? And do we think that that has been serving us in an effective way? And then just a second on contact tracing, I thought we were up to our 10,000 contact tracers now. So do we need more contact tracers to handle this level of transmission? And are we trying to build out that system any further?
So on the first question, today's testing guidelines really set a set of priorities, tier 1 and tier 2 priorities, that look to really focus our initial testing on people who have symptoms and who through testing, we can make really important efforts in suppressing disease transmission. So although we want to maintain access for the general population to testing, focusing first on those whose clinical course or community can really benefit from this more targeted testing approach, not as an exclusive, but as an initial priority group, is very important for us, especially during this time where transmission is high and turnaround times for testing have increased. This is all done while we are in parallel working to increase testing capacity across the state through the ongoing efforts of the testing task force. As it regards to your question on contact tracing, we have absolutely hit our goal of 10,000 contact tracers. We are working with the counties to make sure that state workforce is deployed to them so that they can join their local armies of contact tracers and disease investigators, so that we can do the investigation and contact tracing on as many cases as possible. We did not build the current contact tracing program on this level of transmission. I think local and states across the nation have recognized the need to be targeted with some of our contact tracing at this moment in time, but to work aggressively to bring down transmission rates so that our contact tracing workforce is sufficient to address the need with contact tracing and use it as the powerful public health tool that it can be with COVID, with our COVID response.
Jill Cohen, New York Times.
Hi there. I wanted to ask if there were any efforts to, or if there's any thought about mandating that counties report test results by industry or employer, because it seems like that's been a source of spread as much as, sort of one-off family gatherings, or can you talk a little bit about how the state is looking at workplace transmission?
Yeah, I think it's a very important question. And as we evolve our understanding of where COVID-19 impacts the most people, the most vulnerable to the worst outcomes of COVID-19, you're absolutely right that we hone in on what we have typically described as the essential workforce, the essential workplaces. I like to add congregate essential workplaces, which are those larger factories or areas where you have a large number of people who are mixing and interacting, often in closer quarters. Although we have strong guidance and support to those industries to set up their businesses and approaches in a lower risk way, we know that testing in those environments is key. We haven't specifically worked, at least as far as I'm knowledgeable of ensuring that we have reporting by industry, but we do have quite a bit of intelligence from our local partners, our own enforcement and compliance entities at the state, where we are seeing increased number of cases and being able to address that. We certainly are going to be looking through the renewed task force at how testing and reporting of testing is targeted to some of those areas where we're seeing the greatest transmission, including some of the workplaces that you mentioned. Of course, we are aware and increasingly aware of the importance of household spread, and that family gatherings, small and large, have increasingly become an area where we're seeing an increased number of cases. And our renewed focus, both with our local messaging and statewide messaging around wearing your mask, staying physically distanced, reducing mixing with people outside of your household, staying away when you're sick or you've been exposed, and washing your hands. All of that goes to the deep contribution to reducing transmission when you're mixing within your own household and without.
Taryn Luna, LA Times.
One of the 6 indicators Governor Newsom and the state put forward was the ability to test everyone with symptoms and to contact trace positive cases, which he said in April was necessary in order to safely reopen and suppress the virus. Counties are still struggling with contact tracing, tests are becoming harder to get, and we've had these equity problems all along. Results are lagging, and it's clear that since we reopened, the virus hasn't been suppressed in California. So why did the state set a benchmark and then open before it was met?
So we, as I think many of you know, we followed our data very closely in our planned reopening. We saw not only temporary flattening of our curve, but a long-standing reduction, not just in cases, but stress on our hospital system. We built up our testing capacity throughout the state. We were well on our way and have now exceeded our goal in terms of testing availability and volume. And we provided a strong set of science-based guidelines for industries to, in a lower risk way, reopen. And throughout the last many weeks, we have seen an increase in transmission and an increase in number of cases and stresses on our hospital and care delivery system. And it's for those reasons the governor all along, and we've all along described that our reopening would be using a tight finger on a dimmer, that it wasn't a light switch. And we were always prepared to reinstitute some of the changes that we made as part of the stay-at-home order to make sure that we don't experience extreme surges. So we feel that we have continued to be guided with a consistent approach to how we're handling the reopening. And during this time where we're seeing increased transmission, some challenges with testing turnaround time, the state, with a number of partners just throughout the state and across our federal partners, are bringing a set of resources to California to make sure that we bring the transmission rates down and can continue to build up our contact tracing workforce across the state, deploying that state resource into our local communities. So as that transmission of cases comes down, we can more effectively contact trace all of the cases that we find and are aware of throughout our communities.
Final question, Catherine Ho, SF Chronicle.
Hi, can you go back to the emergency regulations you'll be issuing from the Department of Managed Healthcare? When will those be posted? And is it fair to read that as similar to what Santa Clara County's health order did a few weeks ago, that called on the private healthcare providers to do more testing and health plans to pay for it?
Yeah, so the exact date and time that these emergency regulations will be released, we'll get back to you with when that will happen. They are being worked on now and will soon be released, but I don't know the exact time. They will focus on ensuring that our health plan partners are in a position to reimburse for that test, for the COVID test for a number of populations. And in doing so, it will reinforce and support our delivery system. Those are clinics, larger health delivery systems, hospital systems, to be able to test more and test more confidently, so it's widely available. So together with our focus on building up capacity in the community clinic system and our care delivery system at large, plus the new regulations to support health plans to reimburse for testing, together that will support a broader set of people having access to testing when they're symptomatic, when they've been exposed, when they've been at risk of being part of an outbreak, so that we can get timely and actionable information from those testing supports. So with that, I just want to thank you all. Thank Secretary Castro Ramirez. Thank our new co-chairs of the Testing Task Force. Thank all of you for joining us today. Look forward to continuing to provide you regular updates on California's response, and look forward to partnering with all of you and continuing to wear our masks, to stay physically distanced, to wash our hands, and above all else, avoid mixing if you can, especially at this time when transmission is higher, and working hard to keep our families and our communities and our entire state safer as we address the COVID-19 response across the state. Thank you and have a good afternoon.